Doing her transition to her advanced stage was very challenging because she was still mom in a normal sense of the word. So I could relate to her, she can still recognize me, but now it's getting to be more challenging. She has lost recognition. She no longer recognizes me, she doesn't know where she is, so it makes it even more difficult for me to manage her. Do not let the illness overwhelm you, do not let the illness manage you. You have to manage the illness, the disease itself. So don't let it be the main part of your life. It is a part of your life, caregiving, but do not let the illness overwhelm you.
一个看护者，我相信要经过这些段落都不容易的。最要紧要有爱心那么耐心，还要做到大家开心，就是这样。那么最困难的就是说，有时候他会闹别扭，他本来是一个很和气的人，会慢慢变成好像不理不睬你，就是这样。不止因为病人不懂得痛苦，可是看护者是最束手无策啦，就是很辛苦。没有人喜欢说生病了哈。如果走到这一步，就要看有什么方法找到协助。
And so 1960 was a pivotal year for me in Singapore. In that, I began my volunteer work. Then, Professor Teoh Zsin Woon, the pioneer of menopause at KK Hospital, set up a menopause clinic, and I was his patient. He invited me to set up a support group for menopause women. That was 21 years ago, and my age is no criteria to what I can do, and age is just a number. In fact, I don't pay much attention to my age. So keep on laughing and keep on caring, and this is what I just love to do, to cherish it.
It's not the technique, the massage technique that makes a difference. To me, it's the touch. And the reason why is because many of the patients in the wards, they have been stigmatized. So the mere fact that you have relatively stranger sort of individuals coming forward to touch them, that in itself is very therapeutic. We have to come across the death, the passing away of some of our favorite patients. That is not easy because you can imagine you journey with them week after week, and then the next week you go there, the nurses tell you, oh, the patient has passed on. So it hurts. So that's one of the difficulties that we face as volunteers. The takeaways from volunteering far outweigh the time and effort that I give. So once we adopt that mindset, you'll find that you will stay committed, because really volunteering makes you a better person.
Our program consists of two initiatives. One is the Club Epic program, where we have our occupational therapists together with our other case managers, psychologists and our peer support specialists come together to provide different programs ranging from groups like skills training as well as like adventure, outdoor sports.
We are hoping to actually instill more hope in our patients because they have come, the impact of the illness actually has really impacted them in their functioning sometimes, and sometimes in their social interactions and cognitive impairments.
One more thing that's really important is also that knowing that we are not alone doing this program, because we exist in not just within our hospital, but we also have been tapping on other resources outside, for example, institutes of higher learning, where they send students who are interested in volunteering to come work with us together. On top of that, we have been working with community organizations.
Mental illness is not dangerous because our clients are really fun working with, and they have had lots of fun as well. So it was not like they come in with lots of questions and doubts, but at least when they leave, they are leaving with more confidence and less stigmatizing.
New Boy Scout has been founded in 1985. We work as a team, number one. And I to treat every members as a big family. Third, and we have to share each other opinion. Whenever we face any problems, and we try to tackle to solve it. That's the most important part of the club. And we have to work together. And no one is to walk alone. And we try to plan a lot of vertical enrichment program and cooperate with the Cancer Society.
Member of the club. After learning, we take good payment and carry on this club as long as possible because it was very difficult at first to form the club. It's difficult to get patients to come and join because there is a club that keep you and many of them couldn't believe. So when they came later, they thought it's very interesting to join the club. And also that after that, like some housing for the members. So from there on, they just spend on.
It was 2004. Dr. Singh invited me to set up a colon cancer support group at Tock Seng Hospital. At first, it was just meant for the colon cancer patients at Tock Seng Hospital. But I was ambitious. I wanted the support group for the whole of Singapore. And we always say we have to look at I always say we have to look at the patient holistically. As far as I'm concerned, I'm not looking at the patient just intestinal, the colon cancer. The doctor does that. So when I look at the patient, I look at the patient holistically, and I like to talk about lifestyle. We do not engage talking to the patient about the surgery, about chemotherapy treatment. No. That's doctor's business. Our business is to let the patient know the right kind of healthy lifestyle we should lead from now on. So now let's walk right. So we're here to try to help them to modify their lifestyle and also to give them emotional support.
So our objective is to promote and encourage safer sex in the high-risk groups.
And safer sex, besides safer sex, we actually touch on negotiation skills. We actually get the sex workers to learn how to persuade their customers to use condoms, and we also equip them with the knowledge.
We tend to see the marginalized group. We tend to label them without. We tend to burden them without labels. So I guess when you help people, you don't ask yourself who you are helping. You ask yourself why you are helping them. We are helping them to equip them with the basic knowledge of HIV and STI prevention. Don't see their sex work, see them as helping an individual.
Because healthcare is for everyone.
Yeah.
It's everybody's right to have access to healthcare. Yes. To overcome the stigma, we just go about doing our health promotion work, regardless of what other people think. We just go about giving them the health information, just go about doing it. I mean, just do it. We don't stop to think about, is this person going to think this of me or not? We're just going to do it, yeah.
As you can see, I'm getting on, I'm passing on to all the younger people here now. And they are doing a good job to keep it going. And I think it's a tremendous feeling I have that I have a group of friends there. I just wish all the volunteers will just see the goodness in the whole thing and keep coming to support. And don't give up, never give up.
A few weeks ago, a lady wanted laksa, I believe, yeah? Laksa or was it mee goreng? It was one of those. And yeah, and we immediately texted Corey, who's our buyer, and she went out to buy and she brought it and she was really, really happy with that. So small little things like that, I mean, it may not be much for us, but to the patients it means a lot. And for the non-volunteers out there, I think we've had a very good life in Singapore, a very clean, safe environment, okay? And I think it's about time where we try to contribute a bit more, give back to the society.